Hi guys, it is Donna with Life Check with Donna, and I just wanted to hop on and share my go-to tool for finding Medicare plans for my clients. Um, this is the site that I use because the information is unbiased, it is completely impartial, and it is complete, and it's individual, it's customized to you, okay, to each of my clients. So the first thing we're going to do is Medicare.gov. All right. The site's going to look a little differently based on how you're logging on. I'm on a desktop, so this is what mine looks like. But if you're on a cell phone, what you would see would be a menu over here in this right corner. And these tabs will be located within that menu, and you can log in. If you haven't created an account, but you can, if you're already a Medicare recipient, I highly recommend that you create an account, because what it does is it allows you to input your providers, your prescriptions, your pharmacies, and it saves it for you. And the information follows your login. You can update it, you can add or remove, you can change things. And again, it follows your login. So if you can, highly recommend. And you'll need to create this yourself. Your agent cannot and should not ever create nor log into your account. All right. So for this illustration, what we're going to do at Medicare.gov, we're going to log in to find health and drug plans. On the cell phone, it'll ask you to log in, or you can continue as a guest. So you're going to want to continue as guest. So find plans now. Continue without logging in. Here, you'll see options if they are available to you. Currently, you can enroll in a 2023 plan or 2024 as an open enrollment. Literally just started today. But if you only see one thing, that's it. That's it. Again, I love this site because it doesn't leave you guessing. All right. So the first things first, continue without logging in. And of course, if you have an account, you can log in. But we're going to continue without logging in. And I'm going to input my zip. You would enter yours. Continue. And the next thing you're going to see is you're going to select the type of plan you want. There's Part C, your Advantage plans, Part D, your prescription drug plans, and then your Medigap policies or your supplemental plans. For this purpose, we're going to choose Part C. If you're not sure which part, you can always look down here. This information button will give you information about each plan, and you can go from there. All right, find plans. Do you get help with any of your costs from any of these programs? If it's yes, you're going to select the program. If you're not sure, you're going to say you're not sure. If you don't, you're going to say you don't. We're going to say you don't. When you say you don't, and I recommend if you're not sure that you come here and it'll ask you if you want to learn, if you qualify for any of these programs. Yes, you do. Let them tell you no. The income limits are different based on the program. So even if you've been turned down for one thing or the other, try with something else. Okay. All right. So I don't get any help. Next. Your search preferences. Do you want to see your drug costs when you compare plans? Yes, you do. You certainly do. So you're going to say yes, and it's going to give you a little message that you need to get yourself prepared. You're going to need the name, the drug, the dosage, the quantity, and the frequency for each of your drugs. So if at this point you don't have that information, stop and come back when you do. All right. So next, begin typing to find and select your drug. If you start typing, it'll bring up a list. If you're not sure about how to spell it, look at your bottle, because of course we have your bottles, right? Add the drug. This is the point where you're going to need to know your dosage, your quantity, and your frequency. There's going to be drop-down menus where you can choose. Select your dose, your dose. If you're not sure, guys, be sure, because it will matter. Certain things may be covered. Certain things may be covered at a different price. Certain things may not be covered. Be sure. All right. We're just going to select one. The quantity, 30 days, 60 days, 90 days, whatever. Frequency, how often do you feel? Every month, every 2 months, every 3 months? Choose what works for you. Add to my list. Gonna add one more. All right, again, with the dosage, this is important. Some of these are covered, some of these are not covered. So you're going to want to make sure that you check the one that is right for you. I'm just going to choose one. You need to check the packaging, that is either is yours in a 4-pack or is it a single. All right, we're going to go 4-pack, and you get one every month. All right, one a week. add to my drug list. When you're done, and you'll add all your drugs. I'm only adding 2 for this illustration, but you're going to add everything. All right. All of them. Once you're done adding all of your drugs, you're going to done adding drugs. It's going to ask you to choose up to 5 pharmacies. It will pull your zip code over. So this is Fairmont. But if you know your pharmacy is in Dillon, okay, you can choose that zip code, or you can put down the name of your pharmacy. That one's optional, but it will pull your zip over. And then I recommend that you always choose mail order pharmacies, because for some plans, that's the cheapest rate. For some plans, it's not. Some plans it's not even offered, but sometimes it's the cheapest. So just to be sure, just to check, always add it. We're going to add the first 2. You go down and you scroll and you look for your pharmacies. You can add up to 5, and we're just adding the first 2. All right. And so once it loads, a couple of things I want you to see on this page before we get into your plan details. Okay. At the very top, it's going to tell you what year you're viewing. Plans for 2024. If you want 2023, change it. Okay. It's going to tell you there are 21 available drug plans. Those are your Part D plans. But remember, we were looking for C. And so we're looking at 35 Part C plans in your zip code. All right. If your location is not correct, this is where you change it. You edit here. And then for plan type, remember, we were looking at Part C, Medicare Advantage, but you can choose to look at Part D plans. All right. But we're going to stick with Medicare Advantage. And then you can look at different types within Advantage plans. And so you can either choose HMO or PPO or both. Quick tip: if it's a radio button, a circle, then it's either or. If it's check mark, if it's boxes, you can check as many as apply to you. So right now, first off, we're going to just leave it like this, Medicare Advantage, and I want you to look at how many plans there are available. So before you make any selections, it's going to tell you there's 7 plans available to you in your zip code. Regardless of what you see on television, what they send you in the mail, what your next door neighbor tells you that they have based on their zip code, regardless of any of that, this is going to be based on your zip code. Okay, your zip code. So you're going to always want to check here to see what you can get. Again, I don't care what they tell you can get on television. I don't care about this bell or that whistle. This is the plan. These are the plans available to you in your zip code. All right. So we're going to come back up here and we're going to say HMO. So when we add HMO and we apply, it's going to change the number of carriers, and it may not, but it could change the number of carriers. We had 7, we're down to 5, right? Come back up here. Let's say PPO versus HMO. And then there are 1, 2, 3, 4, 5, 6 PPO plans available. Okay. So for this illustration, we're going to say HMO and PPO. So we're going to apply those. And you come back down and you should have all 7 carriers again, but it'll show you all the carriers that's available based on the criteria that you selected, and you can always change it. Okay. All right. So another thing, now by the filters. Okay. You can filter by benefits. I recommend that you add them all, just so, because right now you may not need dental, but 2 months down the road you might, and it might be a good thing to have it. So I suggest you choose them all. All right, we're going to apply. And once you apply it turns blue to let you know you've selected something in here. Insurance carrier, let's say you already know you don't, and you see how it already changed based on the benefits that we selected. Remember, we had all 7, but based on the things that we've already selected, only 5 of the 7 offered everything that we selected. All right. Drug coverage. We want to look at a plan that includes drug coverage, right? Because if you get an Advantage plan, most of the times it should have drug coverage, but if it doesn't, you also have to have a Part D plan. But with an Advantage plan, you want to try and get one that includes the Part D coverage, so you don't have to pay an extra premium for the drug plan. So we're going to include an extra premium. You may still have to pay an extra copay or deductible. All right, so includes drug plan, apply. It's going to turn blue. Still got the same 5. Star ratings. A little pro tip for you. If you go with a 5-star plan, and if you need to change it, you can't. You're in the best thing that is offered according to your peers. And this is not based on what the company has said. This is what other people like you, recipients, have said about the plan. I would say start with a 4-star plan and up. And that way, if you need to change, if the plan's not working for you, at least that qualifies you for a special enrollment period to go up. Now you cannot go over, you cannot go down, but if you're at 4, you can always 4 or less, you can always go up to 5. So we're going to say 4 stars and up and apply. All right. And so here you'll see all the filters that you've selected, right? You can always go in and take something off or put something on, but for our purposes, we're going to leave them all on. And I recommend that's where you start. You can also sort, and look, we went from 35 plans to 7, right? This 7 of us, you may have a lot and it won't fit on a page. So it's just telling you, if this would have said 5 of 7, you need to go to the next page and see the last 2. So that's what that means. It means there's 7 plans and it's showing you 7 of those 7. This, you can sort your plans by lowest deductible, lowest health deductible, lowest drug and premium cost, lowest monthly premium, whatever you want to do. Remember, this is your plan that you're building, so you get to call all the shots and you get to play around here. So we're just going to leave it at lowest drug and premium cost. Okay, so real quick, this is what you see when you first looking at. This is just the first plan that pops up. We're not promoting any particular plan. This is just the first one that pops up here. You'll see the name of your plan, their star ratings. This is already a 5. It'll show you the premium, the total drug and premium costs for the rest of the year, your deductibles, and how your maximum out of pocket. It'll also show you the plan benefits over here. And if you want to see more of those, you click down more and you'll get to see more benefits. And then there's a way for you to even see even more, and I'll show you that. It'll show you your co-pays and co-insurance for your doctors and your specialist visits, 0, 10, and it tells you it includes drug coverage. When you look in the plan detail, you can either look at the drug costs here or you can wait to get the plan detail. All right, so that's that. What we're going to do is we're going to add plans to compare. I'm just adding apples and apples, so I'm going to add 3 different HMO plans. Now, you don't have to do HMO plans and HMO. You can add HMO and PPO, but for our purposes, I'm going to add 3 HMO plans because I like you to be able to see apples versus apples, and then we compare oranges and oranges, PPOs and PPOs. But right now, we're going to go with 3 different HMO plans. I'm just randomly selecting them. We are not promoting any carrier. So the first one I'm going to choose is the Humana. Click add to compare and it'll pop up down here. All right, you can compare 3 at a time. So we've got Humana. We're going to add a Blue Care Essential, Blue Cross Blue Shield, add to compare, and now we're going to scroll down so we see enough. Now we're going to add Aetna's PPO plan. Nope, we're going to add HMOs only. So let me get down to Aetna's HMO. PPO. Oh, okay. So we only have 2 HMOs in this plan. So we're going to go up and choose Aetna's PPO. All right, here we go. Add to compare. All right, so when you have the 3 plans, you're going to hit compare. This is a beautiful tool, guys. You get to just look at these 3, and I recommend you compare 3 of them at a time, all of them, unless you get to your plan like, oh, this is what I want. I'm sold here. But I recommend that you make sure that it's the best thing before you choose a thing. Okay. All right. So the first thing you'll be able to see is what the monthly premium is, the plan and the drug. Humana Gold, HMO, nothing. Blue Cross, HMO and drug, nothing. Aetna, PPO, $18. All right. Then here's the star ratings. Humana has the 5. These 2 have 4. Your annual health deductible. I'm telling y'all, this thing is awesome. The health deductible, 0 across the board. The drug plan deductible. The deductible is how much you have to pay out of your pocket before the plan kicks in. All right. So Humana, 0 health, 0 drug. Blue Cross Blue Shield of North Carolina, 0 health, but there's a $150 drug premium deductible. What that means is that before they pay on your drugs, you'll pay $150. Okay. Same deal with Aetna. The maximum out of pocket. This is the maximum, the most you'll spend on your health care this year. All right. And it's going to vary. $3,600 for in-network for Humana, $49 for Blue Cross, $4,950 in-network for Aetna. If you're out of network, you're going to pay more for this plan. All right. Health premium, 0. Drug premium. Aetna, the $18 is a drug premium. There's no premium for your health plan, but you'll have to pay $18 each month to have this plan with Aetna. All right. Excuse me. Part B premiums. It's the same across the board for everybody. You'll notice this is an increase from last year. It was I want to say 164.60. It went up for everybody. Sorry, but it is what it is. Now the features of the plan, this is where you get to compare. They all have these things, but that big red X means I don't have this. So if in-home support services is important to you, this is not your plan, right? This is not your plan. So this is what you'll want to look at to see if they have it or they don't have it. Then that's the first guide. Where the first guide is how much it's going to cost you, but then we're going to look at the benefits of the plan. All right. Now we're going to look down here. Primary doctor visits, no copay, no copay, no copay. $10 if you're out of network. All right. And that's one of the deals with which is weird because PPOs generally have a larger network, but specialists, how much you'll pay for the specialist? 10, 25, 35, 45 out of network. It matters. You check these out, all these numbers out, guys. Diagnostic tests and procedures up to $70, up to $25, up to $75, 20% coinsurance if you go out of network. It matters, and it varies by plan. Lab services up to $50, up to $5, nothing. All right. So you got to kind of weigh the cost of what you need. If you know you have a lot of lab work done, then that's important to you. But we're looking at the bigger picture, not just one thing, but we consider everything. Okay. Radiology up to $300, or a 20% coinsurance up to $120. Out of network, 20% coinsurance. And we're going to do this for everything. Emergency care, $135 per visit, always covered. $120 per visit, always covered. $100 per visit, always covered. The reason it says always covered is there's some certain cases where it's not covered. So you're going to want to make a note. If it says always, or if it doesn't say anything, or if it says sometimes, that's something you need to consider. Urgent care, 50, 60, 35. So we're going to do this with everything. Before we move on, I want you to look at inpatient hospital coverage, overnight stays in the hospital. Look at this part. In network for this plan, $295 per day for days 1 through 7. Days 1 through 7. $335 per day for days 1 through 5, right? $325 for days 1 through 6. So you gotta look and you gotta read. You gotta pay attention to the details. It's gonna do the same thing for outpatient. Most preventive services are completely free to Medicare recipients. And okay, extra benefits, hearing aids, copay, nothing. Look at it, y'all. If hearing matters to you, then this matters. Preventive dental, very, very general dental, exams and cleanings, no copay, no copay, no copay. Comprehensive, some coverage. And when you look in the plan details, I'll show you and it'll give you a breakdown. But right now we're just looking at the comparisons. Eyeglasses, 000. Wellness covered, transportation, 0 copay. And so you're just going to check skilled nursing, $20 per day for days 1 through 20, 0 for days 1 through 20, 0 for days 1 through 20. Check everything. All right. So you're going to come down and you're just going to check all the things. All right. Drug costs, whether or not your drugs are covered. So this is important. So we're going to scroll down. Remember, we had 2 pharmacies. It tells you right now, and this is all of them are in network. They may not be. It'll tell you what's in network and what they prefer, and how much it's going to save for you. All right. So yeah, you just check for all of them, and then look at the difference in the prices for your drugs. Look at that. This matters. If you take any kind of prescription pills, this thing comes around every month. This matters. So you want to look here. You want to look at what's in network, what's preferred. Is meal order cheaper or is it not cheaper? Look at this plan and how much the difference between meal order. This is why I was telling you check it, because sometimes it's better. The difference between meal order, the preferred, and the in-network pharmacy. Look at the difference. See that? All right. So you're going to want to check all that. All right. So what you're going to want to do now to dig into the nuts and bolts, you're going to look into the details, and we're just going to choose the first plan to go into the details. And this one you won't be able to see side by side. You'll have to actually literally go into each plan to compare. All right, same deal. Real quick overview. 0001642 for your meds. All right. Gives you a lot of the same information, but what we want to dig into is the general, the more specific information, the address of your plan. If it matters to you, if your plan is North Carolina based, or you don't like Kentucky, you don't want to plan from Kentucky, well, this is where you're going to find out. No shade to Kentucky, and remember, we're not endorsing any plan. All these limits you saw before. If you see limits apply, click it to see what the limits are. And sometimes, a lot of times it says the same thing. Sometimes it changes. So if you see it, you need to click it and read it. All right. Don't just assume it's going to say the same thing. We covered all this before. This gives you information, skilled nursing. I'm going to get down to, all right. This is going to tell you about your mental health services, your opioid treatment services, other services, durable medical equipment, your wheelchairs, and your oxygen tank, prosthetics, dialysis, your diabetes supplies. It's going to tell you how much these things are. All right. And if you don't see it, chances are it's not covered. All right. Be mindful there. And now drug coverage, remember it showed you in network, preferred, and in network. So we're going to look at this. If you need to change your pharmacies, like you chose the first three, but you want to go back and add the last, you can always do that right here without having to go back and do everything else. All right, look at this, the amount that you pay. And it's going to show you for each drug, it's going to show you, it's going to give you a breakdown of your cost. All right. So for the lisinopril with South Robinson Medical Center, 180, nothing here. The Trulicity, 1640, 1680. So again, it matters. It matters, and it gives you a total cost. Now you see the breakdown of why your drug cost is what it is. All right. This one is important because it tells you when you enter your coverage gap. And if you click down, it'll tell you. This is the donut hole. When you get here to this point, you'll pay no more than 25% of your covered drugs. And hold that thought, I'm going to show you exactly what it means. So it tells you when you get to this point. For this plan, it's June. You got 6 months. For this plan, it's April, 5 months. All right. It will tell you if you'll come out or if you won't come out. For this particular plan, you won't come out. Some people have drug costs that are greater than the catastrophic limit, greater than 7,000. I'm not sure, but 7,000-ish. And if you spend more than that, then you'll come out of the donut hole and you'll go to the catastrophic limit, and then there'll be a certain amount that you pay. But at this point, you'll be in the donut hole for the rest of the year. You don't come out. If you did come out, it will tell you here, you get out in November, or you get out in September, whatever, it will tell you here. All right. This will give you a breakdown of what you pay while you're in the initial phase before you hit the donut hole. So before you hit the donut hole, it's going to cost you $45. January, $45. In February, March, April, May. Remember, then in June, you hit the donut hole. And at this point, you'll pay no more than 25%. Let me make sure. No more than 25% for your covered drug. So at this point in June, this is no more than 25%. And then you see it doesn't change. It doesn't have to stay the same. It can go up. And again, you need to compare prices here. All right. You need to compare the prices here for each of your drugs. All right. And then it will show you how much you pay during the phases. So the initial phase, and then how much you'll pay in the donut hole, how much you'll pay in the coverage gap, the donut hole, and then how much you'll pay after the coverage gap. But remember, you don't come out. So you're kind of much paying this for the specific plan for the rest, because they already told you don't come out of the donut hole. All right. And then if you want more information, it's here. This is pretty good, y'all. Just tells you what tier your drug is, or it tells you how they design it. And there's a spot here that tells you whether or not your drug is. Yeah, it tells you what tier your particular drugs are, right? Whether or not there's quantity limits, whether it involves step therapy, whether or not you have to get a no before you get a yes, right? And whether or not it requires prior authorization. Again, this tool is fabulous. And I know it's a lot of information, but that's why you want to get with a licensed agent, Medicare agent, because this is what we do. We are trained to compare these things for you. You tell us what you need, and then we'll go and we'll do all this work. Quick disclaimer. For me, I represent several carriers. I don't just represent one. If you call and you talk to somebody that represents Carrier Sunday, That person is going to tell you what carrier Sunday has. They're not going to tell you about carrier Monday. They're not going to tell you about carrier Tuesday, Wednesday, Thursday. They're only going to tell you about carrier Sunday, which is why I recommend that you start here. And once you determine that you like carrier Sunday, then if you like, then you call carrier Sunday. But you start here because the first thing you need to know is whether or not carrier Sunday is the best for you. It might not be. It might be, but it might not be. And they're not going to tell you it's not. They're going to tell you about their best plan for you, but their best plan for you, carrier Sundays, may not be the best plan for you, right? This is why you come to Medicare.gov, because they're going to tell you the God's honest truth about all of it. And you'll get to see it. You'll get to see it. All right, this is just your Part B drugs, your chemotherapy, and if you need to see other ones, it'll be more in your plan details. Extra benefits tells you about hearing. We went over that. Preventive care to tell you what you get. Fluoride treatments most times are not covered because they're for kids, but in this case it is. X-rays. So you just look down and it'll tell you about all the services so that you can compare, right? Look at this. If you go for your vision exam, is covered, zero copay. Your contact lenses are covered, zero copay. Your eyeglasses are covered, zero copay. But you can't go in there and just get frames, or you can't just go in there and get lens on most of the plans. You might, you can on this particular plan. All right. You more extra benefits. Chiropractic services, not covered. So if you know you need a chiropractor, this is not your plan because it's not covered. Acupuncture, some coverage. Massage therapy, not covered. Alternative therapies, not covered. So it'll tell you if you know you need a thing, you check in more extra benefits to see if that thing is available to it, whether or not it's covered. This is how you choose your plan. This is how you choose your plan. All right. And again, it tells you about the star ratings. Okay. So that's your plan details. So we're going to go back to the top, go back to comparison. Again, you have to do that for each of your plans. It won't do it. There's no way to compare the details because it's a lot of information. So you'll have to make notes and then come back and then compare a plan and make notes again for the next plan. All right. Back to plan results. And guys, let's get rid of these guys. So this will go away. Remember, 7 plans available to you with your options. Look at all 7 of them. I know it seemed like a lot of information, but trust me, at the end of the day, this is your plan and you need your plan to do what you need your plan to do. And you don't want to find out in the middle of the year or 2 months in that your plan does not do what you needed your plan to do. So check it. And if you don't want to check it yourself, call me, I'll check it for you. All right. So this is what you can do. And again, I love this site because you get to customize this for you. If you don't care about fitness benefits, get rid of them, right? If you don't care about, if you know you don't want a PPO, get rid of it. Right. And then, again, it's going to tell you what's available to you based on these plans. Look at the changes here, guys. The only 2 plans that offer the filters what we have are these 2. All right. So you play with it. You play with it. This is your plan. You have got to be happy with your plan. A lot of times when I hear complaints or people want to change plans, it's because they didn't do this. They got blindsided by a need they had that wasn't met by their plan. And so if you start here, again, no matter where you end up, start here. And what I do for my clients, I always start here. And once we know, okay, Sunday is the best carrier for you. Carrier Sunday is the best carrier for you. Then we'll leave this site, even though they say that you can apply from here. See, some of them say enroll, some of them don't. We're going to move, and this will take you to the Humana site or not. Okay. You can join from here. However, I like to leave this site. Let's go back. I like to leave this site once I know Sunday is your carrier and go to their site, because what I can see from that point is the bells and whistles. They may not tell you the bells and whistles here, right? Legally, they actually can't tell you the bells and whistles here. But if you go to Humana, Sunday, take that back. We're not talking about any particular plan here. But if you go to, say, Sunday, you get to see the bells and whistles. But remember, that's the last thing. That's the last way you choose your plan. If you got narrowed down to 2 plans and they're very, very similar, and then the perks can be the thing that helps you make up your mind. But you go through all the other steps before you get to the perks. Do not be sold on the perks. Do not be sold on the perks. The perks are great. Having that extra money in your pocket to help you buy food or help you pay bills. Great. But that's not good when you can't go to the doctor, when you can't get your medications, or when your pharmacy is not in that network. So don't be sold by the perks, be sold by the plan. All right, so that's that. If you have any questions, you can always hit me on my social media sites, inbox me or comment or whatever. You can always go to my website, Donna at www.lifecheckwithdonna.com, or you can call me. You can call me. 910-258-6696, or you can text me. Whatever. There's a couple of things we'll have to do before I can discuss plan details. Now, I can answer any Medicare question that you have, but if you want to talk about Plan Sunday, there's a couple of steps that we have to take to make sure you're protected and to make sure I do what's best for you. But it's not a problem. We can do all of that over the phone, and we will do it, and then I'll get back to you, and then we'll get you what you need. All right. Thanks so much for hanging out with me, guys. Have a great day, and remember, I got you covered to get you covered. And happy open enrollment. Don't be overwhelmed. That's my job. That's my job. I'll take the guesswork out of it. All right. Reach out if you need me or if you have questions. God bless you. Until next time.